And you're listening to and watching The One Thing on Edge Radio Australia. I'm Lisa Byfield from Worldwide Awake Business Network. Thank you so much for joining us. Firstly, before I introduce our beautiful guest and Aaron Malloy, who I'm sure doesn't need any introduction in any case, I'd just like to acknowledge that our other co-host, Leanne Jones, is not with us today. Unfortunately, she had a funeral to attend. And we're thinking of you, Leanne. You weren't with us last week because you're off around the globe, but that happens. And hopefully you'll be back with us strong next week. So
we miss you. Come
we
home.
do.
Come on.
Yeah. And we know who the noisy one is now, Aaron.
Oh, it's just been rather different. Yeah, let's be honest.
Throwing the blame there, Lisa. Throwing the blame.
It's true, though. It is
right
true.
There. Oh, dear.
Yeah, so we have our guest. Oh, has somebody commented?
No,
No,
it's all good.
Okay, fantastic. So Peta Crogan from Zanti Ayurveda, who is one of the Worldwide Awake Business Network members, is our very special guest today. And I'm very excited to have you here. So thank you for accepting the invitation, Peter.
Oh, so honoured to receive the invitation, Lisa. Thank you. It means a lot to me.
Look at all the gratitude going on here.
Yeah.
We've started well.
And I'm really grateful for the meditation that Peter brought us in with. So anybody watching would have no idea, but we do like to do a meditation behind the scenes. So before we get started, because we do things a little bit differently at WABN, and it's really important to set intentions and to be able to put out some good vibes into the world. And what was your comment after the meditation, Aaron?
I actually felt surprisingly chilled, right? Because normally, and from my side of things, obviously I've got all the buttons and controls just out of screen here that people can't see. So I'm kind of focused on those, and I'm worried about the timing, and relaxing is hard. You got me, though. You got me. I actually relaxed.
And what was it, 27 seconds?
Oh,
I think
enough.
pretty much the shortest breath awareness
Any bloke
meditation
will tell you
ever.
27 seconds is enough. Okay, come on.
Oh, how disappointing.
Do you know what I really liked when you said that you're being hugged by the chair and it was like a bear?
Yeah.
And I'm
I
like,
like that. It was pretty
oh.
cool.
That was very, very cool. So you're here today to talk to us about Ayurvedic medicine. Am I allowed to use that word?
You are, and that would refer to the remedial therapies or remedies, I should say, that we use, such as the herbs and spices and those medicated oils. We do call our remedies medicine.
Yeah, because let's face it, in the old days, medicine was food before we...
Well, hang on, sorry, but does that mean that KFC is medicine? Because herbs and spices. I mean,
It was very quick to jump in there. Was that like pre-planned?
No. It's just a frightening indication of how my brain works, really.
Okay, I
no,
got it.
honestly,
I should have brought some of
He
the...
has actually previously been paid on another radio station that will remain unnamed to be the funny man. So all
right.
Oh,
So
dear.
get used to it. I never warn the guests.
No, don't. That's probably the best bet. Otherwise, they wouldn't come in.
No.
But I would just jump in on the when you were talking about the oils, though. Okay, I couldn't help myself. Come on, you said 11 secret herbs and spices. You got me, right? So, but on the oils, okay. As someone who was very much a skeptic of all this, oh my word, essential oils are awesome.
Essential oils are awesome.
Yeah, for somebody who just didn't believe in it at all, thought they were kind of hippie, kind of I don't know, I just didn't think they were real.
And what's your favourite oil, Aaron Malloy?
Peppermint.
Peppermint.
Yep.
Because
peppermint on the old bottom of the foot, and I am asleep. Right, works for me because I have a real problem going to sleep. About 3 hours is my normal process of getting to sleep, from bed to sleep, and a little peppermint on the old bottom of the foot, and catch you later.
So that wakes me up. So
Yes, I was going to say peppermint is very invigorating, a lifting, a brightening oil. But yeah, so interesting that I've immediately gone into liver and lymphatics and other things that the peppermint might be clearing so that you can cool down and go to sleep, because we actually have to cool down to go to sleep. But Ayurvedic oils don't smell like that.
Oh.
Okay, all right. So I want to before we dive into this, because we're actually talking about Ayurvedic medicine, but we're also talking about scar tissue release. And I know that there's going to be a lot of people listening, Peter, who have got no idea what Ayurvedic medicine is. They're going to have no idea what scar tissue release is.
Exactly.
But I want to go back. I'm going to interrupt you, Aaron. I want to go back to square one because you and I met. It was a few years ago now, and we were in Freo, and you shared a lot with me about your background. And I'd love to, if you don't mind, just have you share with everybody what your background is because it blew me away.
Really?
Yeah, very much so. Because you don't just wake up one day and say you're going to be an Ayurvedic practitioner, do you?
Absolutely not.
Yes.
And like you say, people still don't know what I do, and that's probably the biggest barrier in my business is that people don't understand.
I have no idea.
Yeah, I will. So Ayurveda is an ancient Indian health system. It actually predates the written word.
Wow.
So we know that there are written records about 5,000 years old. We've got a big rat in the corner there.
Yeah,
We've got a
think
huge
so.
rat.
Yes.
Huge rat.
Yes. We share the building with a gym. Don't normally have that.
Oh, gym. So it's gorgeous fit people doing them.
Yeah, that's what's going on. Exactly right.
I don't think you've ever thought of them as being gorgeous and fit.
No.
It's just a few other words. But.
Well, it's good. It's always good to put a positive spin on things.
I agree.
But yes, back to Ayurveda, ancient Indian health system, and we would say it's the mother of all medicine because predating the written word, you've got to think that some of that evidence and those spices and herbs that I mentioned before are still in use today that were used back then. And they're used because they continue to provide positive results. Anything that doesn't work has been ditched in 5,000 years, right? Of
course.
Not like some things that we are not so sure about whether they work or not now. Yeah, we won't go there today. We haven't got time. But
so how did you get? So tell us about your schooling. You went to school and then you went to uni.
Yes, so I went to uni and I studied medical science, I guess you'd call it. I majored in pathology and oncobiology, and I did honours in a scientific project under the university umbrella in bladder carcinoma, and I was involved in developing a test for bladder cancer markers and shortening of the telomeres. And anyone who's done any DNA study would understand that the telomeres are a little bit on the end of the DNA cross that shortens with time. And it's almost like a fuse. The shorter they get, the less life we have left in us, or it's a protection, like a little protection at the end. And as that cap gets shortened, then our genetic material becomes more and more at risk of oxidation and other effects like that. So in bladder carcinoma, we could see those markers in the urine, and I was developing a test with my supervisors to
So why
identify
didn't you
bladder
stay
cancer.
along that route then?
So I got my first job after graduating uni, and I went across to Melbourne and was working in Kidney Research Foundation over there, and found myself working towards cancer recovery and cancer cures and other medical breakthroughs, and found myself working with DNA denaturations and radioisotopes every day. And I knew from my studies, as anyone would, understanding those words, that those things cause cancer, right?
Yes.
And here I was working with them. After
Every
learning
day.
everything about cancer, I didn't want to be there. I didn't feel very safe.
There's a reason why when they do the X-ray, they go behind the lead wall.
Yeah,
right?
right. Yeah. And there's a reason why the radioisotopes are kept in a little lead-lined container, and you shouldn't spill them on the bench, but that was happening, so didn't feel very safe, and very quickly found myself looking for a new role. I began a Kindy to 12 teaching degree. I studied interior design, all while working in the lab.
So you were searching.
I was searching. And a number of years later, after getting married, I found naturopathy and began a naturopathy course, and then fell pregnant with one, had one baby, then fell pregnant with the second baby. It all happened rather quickly. I do know how it happens. We worked that out.
We have to have that talk, Peter.
We worked it out. We know exactly how it happened. But found I couldn't continue my studies, so I gave the studies a break. And after my third child, I was ready to go back to school. Went back to that college to find that they'd gone bust. So I had to go looking for somewhere else to study, and I found another college which was offering an Ayurveda talk, and suddenly I was home. Yep. Here was this science, ancient science, which had all the woo-woo that I love, being a good old green witch, you know, essential oils, crystals, the colour of the clothes we wear, the effects of the seasons, the planets, all of that, as well as thousands of years of scientific evidence showing that they knew the difference 5,000 years ago between a vein and an artery. They were doing surgeries, intricate like that, and they could tell that an artery had 3 layers of muscle and a vein had 2. And they've got that in the ancient texts.
Okay, so Indian as in India?
India, yes.
Fantastic.
Yes.
We are on top of this stuff out, the Indians, I tell you right now.
Yeah.
So, and Claire has written, isn't she remarkable? Helps so many people. Love your work, my friend.
Oh,
what a beautiful
thank you, Claire.
Fantastic. Thank you, Claire.
That is
welcome aboard.
Lovely to see you.
Okay, and actually, it's probably a great time to say, if you are watching, look, get involved. We love questions, love comments. This is interaction. So 101 as far as that goes. Love to see it and answer any questions you can.
See
another comment just come through. Let's have a look at that one.
From Nancy.
There we go.
She's asking where I studied my Ayurveda course. I was very fortunate in that there was a school here in Perth. There isn't currently a school running. However, there is Lakshmi Ayurveda in Fremantle, run a number of Ayurvedic courses. So people can go along there and learn various aspects of the Ayurvedic course. There are schools in the eastern states who offer the course, and I actually teach many of the aspects of Ayurveda through my own workshops. And I'm thinking I should have said that first. Yeah. How do we rewind it?
Funny enough, the word I've seen before on in the cappuccino strip in Fremantle. There used to be a little business there years ago. I don't know. Yeah, but it's still there near the old TAFE kind of thing down that way.
Yeah, the TAFE.
Oh, but I'm going back. I'm getting.
Yeah, I don't know. I don't know where you're talking about.
But it could have been. So I'm just
it's such a cool word. It could have even been my flyer. Yeah, because like I say, I do run workshops and courses, and am open to helping you out, Nancy. So. Message me.
Oh, look at that.
I'll help you out.
Nancy is in WA. Look at that. Fantastic. Good to see. Okay. All right. Look, wow. Now, I have a little confession to make, and I'll use this whenever I can. It's very hard to believe, I know, especially at the moment with the sunlight coming through on my face and how white I am right now, but I am actually half Indian.
Yeah, I gathered that from your celebration
my
just now.
Absolutely. My old man's Indian, yep. So, the fact that it's an ancient Indian thing, I celebrate that a little bit.
Yeah,
it's a very cool thing.
Yeah.
So, okay, so if I can smell a little tamarind or you know,
a little turmeric on the face,
turmeric, a bit of this, bit of that,
bit of blush.
So
doesn't wash off.
No, it doesn't. It really doesn't. Not that I want it for any blush, but okay.
Yeah.
But are these the sort of things we're talking about? These famous spices, I guess.
Yeah.
Okay.
Well, turmeric would be my all-time favourite spice. And I do feel like turmeric encompasses the world or symbolises the world of Ayurveda, in that Ayurveda doesn't take turmeric and boil it down and extract a little component and then concentrate that and extract it with something else. Ayurveda uses the fresh root out of the ground.
Right.
So we've got, when we're using that, we've got 300 plus enzymes and cofactors working together with the curcumin, which is the famous anti-inflammatory.
Yeah.
We've got all the aspects in that actual food which will help us take it in, as compared to something which is extracted and concentrated and maybe mixed with something else. We don't necessarily recognise it in our body in the same way.
Little glass thing,
All that orange powder in the glass thing is still very, very good with it. Good for us. Mix it with a little bit of honey, maybe a little bit of coconut oil. Make yourself a paste, and you've got an easy peasy turmeric remedy that you can eat off a teaspoon every day.
Yeah, or you can marinate your beef in it and leave it there for a day or so. Fantastic. Come on, make it work.
It is scientifically proven and in fact so good at anti-inflammatory properties, reducing inflammation in the body, actually will kill, this is turmeric again, will kill off cancer cells in a petri dish at every stage of the disease.
I've heard that.
Scientifically proven, and that's why Monsanto tried to patent this stuff, but they can't because it's natural, grown in the ground. It is so good that, and I completely got too excited then, lost my train of thought.
No, well, I mean,
but get it in your food. Put some in your food. Absolutely, yeah.
Another comment's come in from Nancy, a couple of it, which is fantastic, and I'll bring them up as we see them. But she'd love to know more details about your teaching workshops.
Yeah. So my business is Zanti Ayurveda, and I can be found, you can go to my website. I have a workshops page, so you can have a look there at what my offerings are. And of course, I'm a bit of a prolific writer with my workshops, so I love to teach. I just love to share, and I love to make something that seems a little foreign and a little bit hard to understand, easy to go home and pick it up in your kitchen, like you say.
Nancy, we will put the link in the bottom after the show as well.
I'd love to connect,
so you'll be able to see it.
Fantastic.
Yeah. So scar tissue release, you've actually combined that with Ayurvedic medicine. Would I be correct in saying that nobody else does that?
Probably. Although one of my students and colleagues recently studied the course with me that I teach. So yes, I'm a McLaughlin scar tissue release practitioner and trainer. One of two trainers here in Australia. My colleague, yes, my colleague Jane Conerick and I run this course all over Australia. And we've recently returned from an international summit with the other instructors in Spain, which was just phenomenal.
What a shocking little junket that was.
It was a little bit hard to be with such amazing people. And I tell you what, we all had headaches. We worked hard in the mornings.
Didn't you? Come on.
No, we're not quite into that kind of thing. But we all worked really hard in the mornings and would come together at lunchtime and we were working together, sharing what we do as our other aspect of work. So I gave one of my Ayurveda workshops, but then we'd come together at lunchtime all kind of holding our heads going, why does that hurt so much? Because we were all just so invested that we didn't want to miss a word of what any of these other brilliant practitioners were sharing. Yeah. Wonderful experience.
So what is scar tissue release?
Okay, so McLaughlin scar tissue release was developed by a gentleman called Alistair McLaughlin, who worked in Australia and taught Bowen for many years. He's been a Bowen instructor and masseur for over 40 years. He's also the president of the UK Society of Bowen Practitioners and is now living in Germany with his wife Silke. Alistair, over many years of experience, developed a technique where we use our fingertips and we are quite literally taking contracted, restricted scar tissue fibres that naturally contract in the course of healing and opening them up a little bit. So if you just do, and I do this in my workshops, when we're born all nice and neat. Our fibres are neatly aligned and smooth. So if you just loosely hold your hands together, interlace your fingers, you can do it Michael Jackson pretty easy, right? Okay. Like everything moves, yeah? And as soon as we contract that, tangle your fingers up a bit, squeeze them tight, just your fingers, and try that movement again. What happens? What's happening in your wrists?
Yeah, okay. Yeah, it's clamping up.
It's just not working, right?
Oh, that's no moonwalk, I'll tell you.
No moonwalk anymore. And imagine if there's blood vessels flowing through there, lymphatic channels, nerves flowing through there, and then we've got constriction happening, which is natural in the healing process of a scar forming. Okay. We've now got an area that doesn't move properly, doesn't allow blood flow and lymph flow, maybe constricting those nerve flows, so you're getting aberrant or loss or hypersensitive signals. What we do in our work is with our fingertips, very lightly, scooching under the level of inflammation and further damage, as we're opening up those constricted fibres. So we're creating a little space in there so we can get back to that space where it is still tangled. We're not realigning, we're not tearing anything. There's no more pain needed for the gain.
Right.
We're slipping underneath that and very gently, but specifically and in a targeted manner, opening up some fibres to create some space. So imagine the further healing that comes when we restore blood flow. We're getting oxygen and nutrients back in there, and an old toxic lymph flow can go out.
I'm going to go straight to arthritis, right? So many people have these issues. I mean, this sounds like it's something that could really, really help in that regard. Am I right? Or
Arthritis is a different beast.
okay,
And I would say turmeric is going to be a great friend.
okay,
And other things that help to clear your blood. Turmeric does clean the blood, and it will, because it's cleaning the blood, thin the blood. So I do have to give a little bit of a warning there that your doctors probably will too if you're preparing for surgery.
sure.
And going back to Ayurveda and scar tissue combined, preparing for surgery, I would be getting your inflammation down as low as we can. Yeah. And turmeric would be something we would use if it's compatible with anything else that you might be taking. If you're going in for surgery, we don't want you bleeding too much. So we would be saying come off that turmeric at least 4 days before surgery, because it is capable of actually cleaning and thinning your blood. And that's just something that's in our cupboard. It's available to everybody.
Okay, and on that point, right, so I had a few little health things go on lately. They haven't been too flash, right? And the first things that they want to do, obviously, is, you go in there, it's pill, right? It's just sort of doing this at you. And funny enough, you mentioned the blood thinners, because they put me on the old little aspirin things to thin that out. I would rather have a natural alternative to doing it. I don't like going. I'm not anti, drugs, but let's face it, Mother Nature provides, right?
Mother Nature knows.
It's all out there, okay, and you've just got to use these things in the right conjunction of combinations, rather. So could I replace that? I'm a whole day in, right, on the pills. So could I replace that with putting some turmeric in my goodies?
I would definitely say you can add turmeric into your cooking. You only need a little quarter teaspoon or so in your cooking. I have to proceed with caution where there are other medications involved.
Sure.
And as an Ayurveda practitioner, what I would do is a drug review, pharmaceuticals review, to make sure there's nothing contraindicated, and probably even work with your doctor on that particular thing.
Gotcha.
That particular drug and course of approach, because we don't want to be two things. We don't want to be overloading the liver, but turmeric's very, very good for your liver, but we also don't want you to then overshoot the mark that you're aiming for, especially with things like blood pressure reducers, your statins and things like that. All drugs, they have to be a little bit careful, and that's why if you're seeing someone to get a natural remedy, you want to see someone who's certified and does have the experience and the insurance behind them too.
Thank you for saying that. It's a really big thing. And also, look, I'm finding now more and more practitioners, as far as GPs, are actually working in coordination, okay, with other professionals. We didn't see that before. We sort of just said, have a pill. So that's a great thing. But no, I value your point as far as having that certification and paperwork behind you. That's a really, really important thing. Okay. No, I think that's I've got so many sort of questions floating.
Yeah, and I feel like I've jumped around and not quite answered things. But
no. Well, that's how conversations work, right?
So the quality of turmeric, does that make a difference?
It does. Wherever you can, I'd be going organic, because we all know that those herbicides and pesticides are not good for us, and some of them are actually forever chemicals, which we cannot break down.
That's right.
And leading to those cancer issues like I was trying to avoid in my previous life. So organic wherever possible. And with your turmeric, try the fresh root. I know it's available at a lot of Galati's places. So Spud Shed and the Galati's fresh fruit and veg down in Freo. Sometimes the large supermarkets get it in, but more often your other fresh fruit and veg.
Got fresh.
So, for instance, if I'm making something like a pad thai or a fried rice, or even a paella, I would simply chop up my turmeric and ginger, much like you do your garlic, little finely diced.
Sure.
Yeah.
Aaron's a cook, so he'll be interested.
Yeah, okay. So, and then just a little sort of water or whatever, or maybe a little oil to paste it, or...
You could definitely paste it, especially if you've got a Thermomix, which I used to sell, but I don't anymore.
No, I don't have one of those.
I know there are a couple in our group, in our Worldwide Awake Business Network, who do sell Thermomixes, and they could seek them out if you want the easiest way to make a paste.
I've got a running joke with those. I call them the $2,000 blender. And I'm
That's just an uneducated
I'm not trashing
view.
them. I'm telling you right now, no. I lost one in a divorce. So
so there's a little bitter. So it's a little bitter.
Yeah, it's, that's my way of justifying it.
Yeah.
No, you said something about, was it statins before?
Yes.
Yeah, I don't understand all of that. So in English, because my doctor didn't use English, he used lots of medical terms. And then I go, sure, okay. What are they? What's that all about?
Statins are about reducing cholesterol in the blood.
Okay.
And cholesterol can be an issue because we don't want sticky lumps on the insides of our arteries. We want nice, clean tubes.
Sure.
And when we're developing sticky lumps, there's other fields of thought that think that the lumps inside, the stickiness happens because there may be bacteria or some other injury to the inside of the vessel wall,
Right.
which causes things to then stick to it. A bit like, I guess, if you, like a scar, or if you know, when you grate the cheese and you hold the grater with the other hand, you get a little bit of a rough patch from the other side of the grater on your hand. So I'm thinking that kind of surface
You wouldn't
on
get
the
that
inside
with a
of a
Thermomix.
vessel.
Now, come on.
No, mind you, no, I've got another story to come back to that. But yeah, so statins help to clear some of the stickiness out of the blood and smooth the surfaces, like get rid of those lumpy bits on the
Yeah,
outside.
okay. So the natural alternatives to those things?
First and foremost, healthy diet,
Yep, yep.
nature, connection. I like to say 3 greens a day. So a green juice, which might be just a straight celery juice. I do that most days. Makes me feel fabulous.
Celery is like a vegetable from the devil. No. What decent vegetable do you have that's green that would do the trick? Maybe
I know anything I mention here. Spinach. You need to not have spinach in a blender and juicer every day, just because of the high levels of oxalic acid in it.
Okay.
But stir fried, as your wilted breakfast with an egg on it. A good bunch of get your leafy greens into it. So good diet first and foremost, nature connection, reducing stress, and then we do have great herbs and spices in our pantry, like cinnamon, ginger, turmeric, garlic. They're all going to help to keep the blood clean. Yeah. So going back to nature, back to basics.
Claire's asked, do you meet barriers and red tape? So speak from pharmaceutical bodies with regards to practicing or using certain natural organic ingredients. Are they making certain items unavailable to use?
Yes. During the big lockdown, a lot of imported medicinal Ayurvedic products were stopped at customs and remained sitting on the dock for many, many months, which, if we're thinking of oils sitting in a shipping container at 40 degrees, is probably not really good for them. Yes, they are cooked. We cook them to prepare them, so they have a certain level of tolerance. But if we're thinking about my beautiful organic black sesame oil, which I use for everyday massages, I don't like that to be overcooked. Any oil that we overheat can turn from a regular oil to a trans fatty acid. Yep. The shape goes like this. Putting it really, really simply, and we can't break that down. So that's one thing that happened. And then a lot of other items were prevented from coming into Australia entirely. So a lot of the medical liquids, which are herbal remedies that have been cooked down in water, maybe with some sultanas or sugar to make them a little bit more palatable because they're super bitter, but they're no longer available. A lot of them no longer available in Australia at all.
Is that right?
And then one of the most beautiful products, and you've probably heard of it because it's becoming very popular across all fields, is ashwagandha. Withania somnifera. Somnifera, sounding like sleep, right? Super potent adaptogen, which helps us cope with stress.
Okay.
Builds stable energy within us, helps to balance thyroid function, helps to balance brain function, helps us just first and foremost cope with stress so we can get through the day.
Can I order this in a 44-gallon drum?
Exactly right. No. It is safe for most people to take. I would say, again, see your practitioner to make sure if you're taking anything else. I see your comment, Nancy. If you're taking anything else, there's no contraindications because some things are going to work
of course,
either synergistically and put you over the level that you're trying to reach or against each other. And we don't want that happening. But ashwagandha, I used to make a turmeric and ashwagandha latte, which was becoming really popular, and I was getting it into stores, and then received a notification from TGA, Therapeutic Goods Association, and the notice was that Pukka Tea is a very famous brand from the UK, made by an Ayurvedic doctor. Pukka teas with ashwagandha in them were being recalled and no longer allowed to be sold, and I was no longer allowed to sell my teas with ashwagandha in them because it's classified as an unregulated dose. Even though there's a measured amount, I can put how much is in the packet on the packet. I can put how much is, I can work out how much is in a teaspoon, and you're taking 1 teaspoon in a tea. You'd have to drink 20 of those teaspoons to meet the daily recommended dose. But because it was an unregulated dosage, TGA said it couldn't be put on the shelves.
I'll translate that from the TGA point of view. That meant that Lipton weren't in the industry. That's what it comes down to. That would be lobbying. That's what that is.
For me, it would actually be that ashwagandha is being shown to be so effective in clinical studies that it's preferred to be kept by other industries for their use.
There you go. Always politics involved somewhere, isn't there? What a shame. What a shame.
What a shame.
That Pukka brand too, but I mean, I don't know much about it. I've actually had a couple of their teas. They're quite nice.
Gorgeous. They all have beautiful flavour as well. And that's something that's really challenging in Ayurveda, because most herbs are bitter and most Westerners don't understand the bitter taste and reject it.
Sure. Yeah, that's interesting.
Yeah.
Have you got any case studies, Peter, for the scar tissues?
Scar tissue. I've got many case studies for the scar tissue, and in all honesty, many of these are simply treatment, McLaughlin scar tissue release treatment. But what I am, and I'll tell you about one in a minute, but what I want to have introduced to people's mind is my aim in bringing my Ayurvedic background and scar tissue together is that scars are often overlooked. The effect of surgery is definitely overlooked. And as a practitioner, seeing people on the other side whose bodies haven't healed quite the way they want them to, and as a trainer, teaching our students that there are so many other factors that affect healing and cause a scar to be worse, the more we can prepare for any elective or scheduled surgeries by reducing inflammation, like I mentioned, getting your blood vessels clean, getting your connective tissue working properly, getting yourself full of the nutrients that you need to make the new tissue to do the healing. The more we can do that, the faster your healing is going to be, and the less consequences your scar is going to have on your range of motion, your pain, all of those things going forward. So, I mean, it makes perfect sense, doesn't it? The healthier we are going into surgery, the healthier we are going to be coming out. Yeah. So coming back to your question about case studies, and this is a beautiful one from one of our students, actually, because all of our students present 5 case studies to be assessed as part of their certification. And one of the case studies that came in was about a little girl who'd had operations at the back of her neck and skull as a baby, and was, because of the contraction, was stuck in an extended position.
Oh, wow.
And walked around with her head up, and Mum had to, she was I think 5, Mum had to massage this little girl daily because she would get headaches from that extension and unnatural position.
I understand.
Yeah. So the practitioner lay on the couch behind the little girl while the girl sat on cushions and watched television and worked on the scar up the back of her neck and into her scalp, and was able to soften that scar enough that the girl regained normal positioning after 5 years, after growing up with this thing and people massaging it every day for a lot of that time. So normal positioning, and the headache stopped.
That's life-changing.
Life-changing. And that is actually our little catchphrase, changing lives for the better, with McLaughlin scar tissue release, because we do. Scars are often overlooked, but people don't realise that the hip scar may be actually affecting their lower back or even their shoulder. The ankle scar may be causing changes in the way the body moves all the way up into the base of the skull and leading to migraines.
So when you say scar, like I always think like of a big thing, but can a scar be very tiny?
Scars can be very tiny, and I'm expecting that most people like you are thinking about the visible scar, but we know that less than 10% of scars are visible. So when we're talking,
right? I didn't know that.
When we're talking about scars, we're also talking about everything that's happening subdermally, so under the skin.
Sure.
We have a visible scar on the surface. Let's think about a C-section scar, for instance.
I was going to ask you about
A
that,
visible
'cause I had
scar
a
on the
C-section.
surface,
Yeah.
which may be about as wide as my finger for a badly healed one. But then we know that that C-section wasn't just the 1 centimetre of tissue that we think about when baby is born, but it actually goes halfway through the woman's body. So we have depth.
Oh,
So not just something skinny and neat on the surface, but depth going in. And then the surgeon has quite literally been in there with their arm and cleaned everything out, moved the bladder out of the way, the bowel. The inside of the body doesn't like being touched. Does not like being touched by surgical instruments. So C-section adhesions, other areas which have stuck together and gotten sticky and hard outside of that incision.
Anyone that's watching that's about to have a C-section, just turn off.
Or book in. From 8 weeks after your baby is born, I can help you with that. Yeah.
Okay.
Yeah.
That's really great to hear because, let's be honest, there's so many people out there having Caesars, right?
Yeah. Yeah.
There are.
There really are.
What are the statistics? Half?
Oh, no, well, it depends
More. I
which
think it's
hospital
more than-
you go to.
You
Like,
think it's more than a half? Yeah.
my oldest son was born in St John of God in Murdoch, right? Yeah. Anyway, this is a long, long time ago, but the nickname for that hospital was Caesar's Palace, right? Yeah, because they had so many Caesars there.
And that's not even the birthing hospital.
Oh, well, back then it was the private hospital, and people were booking in for their births.
Schedule them between the surgeon's golf and his fishing.
Spot on, really. So, but when I heard that reputation and that name, I thought, you've got to be kidding me.
Yeah.
But they was at that stage over 75% of births there were Caesars.
Wow. That's a lot. And how many of them would be booked in with a scar tissue release practitioner afterwards just to open that up?
Yeah.
Very few. And
Well, I've never heard of
still
it.
now,
Yeah.
the people that come to me are people who have had problems and are searching. Yeah. So I need to get this information. And my partner says, careful what you, my business partner, Jane, says, careful what you wish for, Peter. But I really want to get this information into surgeries so that the staff and the surgeons know that, one, the effects of scars, how distally they can affect the body, how overall they can affect the well-being, but also how much we can change and improve the outcomes of the clients.
Okay, strange question. Okay, so if you've got a really old scar, okay, like that, how could it affect your life? Like, from a movement kind of point of view or whatever. Or,
I'll give you
Where is the scar?
I have an appendix scar that I swear they used an axe to get the thing out. Right?
Yeah,
It's ridiculous. Okay, and I've had it for many, many years. Appendix out. When I was a teenager. Really, it just. I see other people's appendix scars and go, really? Like,
little.
come on.
Yours is, probably.
Yeah, no, mine's about that long.
Yeah, so we're looking at 20 centimetres there. So I can use you as a great case example without taking Lisa's head off. Just put your right arm up over your head.
Right.
As far as it goes easily, right?
Yeah.
And down again.
Yeah.
And now
It wasn't clunky and crunching, but they-
with your other hand, grasp your T-shirt
Right.
on the right side.
Okay, yep.
Where your appendix is, grasp it hard, make a ball, make it tighten up that T-shirt.
Right.
Tie it in a little knot, nice and tight. Pull the T-shirt tight.
Okay. Yep.
And now put your arm up. You've got some restriction,
Yeah.
right?
Yeah.
So we've got straight away, we've got some restriction from that right lower quadrant into the shoulder that we quite often have lower back pain, some rotation of the right hip, some change in the hip flexor length and therefore change in the gait. All of those things can be little changes that can happen from a scar. An injury skin.
Yeah, because I think, to me, from my point of view, I thought it's just an ugly scar, right? But I mean, I'm a guy, right? So we work on the principle that chicks dig scars. So we're okay, right? Okay, so I'm okay with it. I never thought of it as far as
Shark bites, mate.
that's not a scar. Yeah,
I've got a scar. Yeah.
Oh, dear.
Well, that is a rationale. We have many reasons that people come to us for treatment, and the rationale can be improving the look of the scar, and we can do that by improving the healthy blood flow. The scar may look... now, I have one here for those who can see us on video. By improving the blood flow, the scar may not be as visible. But my first experience was treatment on this scar. My shoulder was sitting forward. I was receiving a Bowen treatment. We were having trouble, or the practitioner was having trouble. And it was Laura Murray, who used to be the trainer in Australia. She was having trouble getting my shoulder to come flat on the table. And Leanne would have loved this being Bowen as well. But this scar used to sit quite high and red, and it was the removal of a mole that had melanoma.
Okay.
The boundaries were clear. I didn't have any further treatment. But during my Bowen treatment, the practitioner said, I noticed a scar here. Would it be okay for me to do the treatment? She demonstrated on my forearm what it would feel like. And I said, yes, yes, yes. And we went ahead with the treatment. Within a couple of seconds, I had sprinkler tears coming out. I'm laying on my back, imagining these sprinkler tears and logicking away why I'm crying so fast, why I was crying so quickly, and kind of going, well, it's the grief meridian, lung meridian, could be grief, thinking and saying this out loud. And all of a sudden, there was this massive sob. And I remembered that at the time, my son was in nappies, and I didn't know if I was going to see him grow up.
Oh, wow.
So had the treatment, and as you can see, that scar is not hugely visible now.
I wouldn't have known how you not pointed it out.
It sits flatter. It's not as sensitive. I can run my hand over it, where it used to be something that I wasn't worried about it. Like, I kind of wore it as a bit of a warning to others to make sure you cover up and don't get sunburnt. But it felt weird, so I avoided touching it. And I went home and my son looked at it, and he, then 17, and he's now 21. He has grown up, and I've been very happy to see him grow up. But he said, what the F, Mum? Did you just have some laser or something? The difference was so profound.
Wow.
And that emotional response is something else that's a profound healing thing that in Ayurveda we say the word for muscle is mamsa. And it actually translates to memory. So your body is made to remember everything that happens to you. That's building blocks for everything that we do in the future. And so if we've got a memory trapped in the body, and there's scientific studies now that show that nerve signals are remembering as well. Nerve and fascia are remembering traumas that happen to the body. We can show that in modern science now as well.
Sure.
So until we release the trauma that's there, the body remembers and holds and contracts away from the trauma.
Wow.
Yeah.
It's very interesting because, muscle memory is a big thing in sports, right? And with everything in life. But specifically, if you can really harness muscle memory when it comes to sport, it's a very great advantage.
Yeah.
It makes great sense to me.
Dial that backwards to the scar. Yeah,
wow.
Exactly.
That's really
And
cool.
another example that's just come to mind is that we had a lady come to us who had been feeling unwell since baby was born, received some scar tissue release, and a pimple developed, and some little, some muck, some pus came out. And so, when we heal more slowly, we're more likely to have infection or complications in the scar that can be then encompassed by our body and can stay there, and the body will maintain this low level looking for what's the problem, there's danger here. So the person feels tired and foggy and unwell, never quite gets back on their feet. But this woman, after having that release physically, the pimple or whatever came out, felt well again.
Wow.
So it was her body looking for this latent infection in the body.
That is incredible.
Yeah.
So Claire says, wouldn't it be amazing if you could provide a service alongside clinicians for inpatients or outpatients in hospital?
That's the dream.
What a beneficial, positive healthcare outcome that would be for the patient.
Well, I think that's entirely possible because I think there's a lot of red tape and there's a lot of resistance to actually getting anyone in hospital who actually knows what they're doing. No. Emergent care is wonderful, and
we're called complementary medicine for a reason. We complement each other.
Thoroughly agree. I was just being silly.
I know,
but
we do get a bit jaded. dehydrated.
Just a little bit, just a little bit.
But you have to admit, though, that what they feed you is disgusting.
Well, we're talking about the lunch, or we're talking about the no?
The hospital?
Sorry,
At least picking up on two dreams.
I was talking about the food in hospital.
Yeah, well, where I was going on this is this, because when now a lot of times with hospital, they won't even keep you in for the test, right? So they'll farm you off, which actually in some ways, I mean, it's very annoying in a lot of respects. But the other benefit, I think, is, okay.
Going home.
Yeah, you could go home. You can go home. But the other thing is, too, you can get referrals to people like yourself. I think that's far more likely to happen if you're going to another place, another physical place, than if they were actually bringing people into the hospital and the liability issues and the bean counters get involved, right?
Yes.
But yeah, that could make the dream a little bit more possible, I guess.
Well, yes. One of my students works in a prominent Singapore hospital.
Right.
He sees 10 clients a day. On their way out through the outpatient system, they have a physical checkup, and he sees them there. He gets to do one scar tissue release on these people, and then many of them go back to their village or home and can no longer afford any more care from him, but he gets to do one.
It opens the door, right?
Opens the door.
So
up.
how many, like if you look at Aaron's case as an example with an appendix scar, which is very old, how many treatments would somebody need?
That's really dependent on the individual. If I go back to a C-section scar again as the example, our modern C-sections are quite small, about 12, 15 centimetres, some maybe 20 centimetres. And I generally say to my clients, we may need up to 4 sessions to get the results we need because of the depth and the subdermal.
Sure.
I don't want to say complications, but the involvement of other tissues.
Sure.
Your appendix scar, we could probably make a lot of difference in one session. Yeah, depending on what else happened in there. If you had an infection or a burst appendix, they might have rooted around in there, cleaning things up a bit more. Yeah, so there may be a bit more adhesion deeper down, and it may be that in the time limit that. So we're working, like I said earlier, we're working under the levels of inflammation. We do impart a little bit of inflammation because that instigates the healing process again, but we're working underneath a certain. We don't want to cause more damage.
No.
Also, the body can only handle so much. It's very intimate and direct work. So the body can only handle so much of it with your nervous system responses and all of that. So within our time limits, we could make great progress in a day, but we may need to then let some more healing happen and see you again a week later.
Is any of that covered on your health fund?
Unfortunately, no. No, I used to be covered as an Ayurveda practitioner for consultations, but 2019, I think it was all...
Yeah.
It was all wiped out, yeah.
Well, forgetting about the negative, let's look at the positive here. We've hit the end of the show. That's not the positive. The positive is I really want – I think what you've been talking about is absolutely fascinating. And from my personal standpoint, I'm thinking, oh, look at this, I can try this.
Yeah.
Some really cool stuff there. So,
and I get excited again with these conversations, so thank you for that.
Good to hear. Well, I want other people to be excited. So, like, can other people – I'm sure people can get hold of you. Where can they find you?
So if you want to find us on Facebook, McLaughlin Scar Tissue Release Western Australia is our Facebook page. Also, same on Instagram. Likewise for my personal business, Zanti Ayurveda, Zanti Ayurveda, AYURVEDA. I have a website, Facebook and Instagram. And if you're listening today, you know where to find me. Just send a message.
And just for Perth, just for Australia, all over the world?
We train all over Australia. I can offer online and in-person consultations for Ayurveda, so I can offer advice. We have practitioners all around the world. Cool. And some exciting news is that I've been asked to become one of 4 trainers worldwide for a method of training, another body of work by Alistair McLaughlin called Art of Bodywork, and that begins next year.
Oh, congratulations.
Thank you.
I'm very proud to say I actually follow you on Facebook, both personally and the business as well.
Thank you.
I saw it there. I thought that seems like something's very interesting. Now, after this conversation, like I've just got to get back in.
We've just scratched the surface, right?
Now.
Yeah.
You're in so much trouble now. Well, we're actually at the end of the show. So with that, I'm going to throw to you, Lisa. Would you like to finish the show for
Yeah,
us.
thank you so much for joining us, Peter.
Such a pleasure.
I'll pop the links down below so that people can connect with you. And thank you everyone for watching, and thank you, Aaron, for being so amazing as always.
Oh, I don't know. I just press buttons. I have no idea what I'm doing.
See you next week.
Thank
See
you
ya.
for